I'm often asked the question, what makes North Atlanta hair restoration different than people in the community or across the country? When I see patients, many of them have seen 5, 6 doctors. I mean, they want this procedure to go the best that it can go. And, you know, oftentimes money is not an issue, and then other times it is. When I came up with North Atlanta hair restoration, I wanted it to be different. I looked at the hair restoration industry as something that was very complex. It was difficult for me, even as a doctor, new and as a physician in hair restoration years ago, trying to figure out what is my role here. It's even more difficult for patients. They see bigger practices. Are they better than smaller practices? Is having a strip procedure better than what's called follicular unit extraction, which is becoming popular? When you look at pictures of people's websites, obviously they have their best work, you know, showing. They're not showing any disasters, but the internet is also very plentiful with many tough stories and many tough pictures of disaster hair restoration treatments. So when I came up with North Atlanta hair restoration, my mission was to be totally physician involved. I recognized early that hair restoration is a very tech-dominated industry, and I wanted to be totally involved from start to finish, meaning do all the consults, not have a sales team do it, meaning do all the follow-ups, not have a medical assistant or a rep do the follow-ups, and then do all of the extractions and also do all of the placements of hair restoration grafts. So with this technique and really approach of dealing with patients, for one, I get to know patients well. I can really figure out their needs, and I can really hit them where their sweet spot is, because everybody's different from a financial background or from what their actual needs are. This is a medical issue. It's not a sales issue. It takes diagnosing why there is hair loss, what the progression of hair loss is, and then making a very good judgment call to determine, say a young patient comes in, well, how bald are they going to be at 50 or 60? So it's my job to not oversell hair transplant and do undersell medical management. My job is to really figure out what's right for the patient. So having a physician-centered approach does all of that, and I think my patients are thankful for it, and it's been a huge source of growth in my practice and total enjoyment as a physician.